Hey y'all, I'm gonna show you how to center and use some of these buttons that we have here. So I don't have a patient and I'm not gonna show you a patient, but we have a monitor here. Let's just pretend that this is a head, okay? They're gonna be laying on their back facing up. You can give them a cushion to kind of tilt their head up just a little bit because you want to center. This is the ear, the EAM, external auditory meatal, will be right here. So the ear is right here, and you kind of want that to be lined up with the orbital line, right? So as long as it's perpendicular to the table, then you wouldn't have to tilt the gantry so much. So that'll help, but if they can't, you know, that you just lay them the way they need to. So pretend this is the eyeballs because they're laying up. This is the mouth, so see that? It's like a happy face. Looks like a monkey kind of, huh? Hello. Okay, so here's your button: up, left, right, down. This moves the table side to side, and then this will bring the table all the way down. So it'll just move it all the way down. This will bring the table inside to the gantry like that. If you press this once, it goes very slowly. You see how it's moving? But if you press it twice with the middle button, press it with the middle button, it'll go fast. See how it's so much faster? Press it with just one, it comes out slowly. Press it with that, you can bring it up. So technically, if this is the external meatal EAM, you want it where that piece is, right? And then you want to center your head. So just kind of move the patient over. Let's pretend this is their face and this is what we're concentrating on. We want it to be lined right here. So we do have this that moves the patient left to right. So see how we're gonna move the patient that way? And it brings it over. But if we use this for a head scan, the gantry will not tilt for you. So for a head, we do not move the patient left to right with this. We will move them manually. So adjust them accordingly here. So it's very important that you have your object isometric to the gantry. You want it dead center to this gantry. So the centering mark, and that's why you want this to be aligned, the axial, and this to be aligned, the sagittal line, right? Coronal line, sagittal line. And then you see these two lines right here. There's one line here and there's one line here. There's an inside light because this is the inside of the gantry. The outside light because it's the outside of the gantry. So this is where it's going to be scanned, where your detector and your x-ray tube is. So this is what this means. This is the gantry, I suppose, and then there's the arrow. So when it has two arrows pointing inside, that's the inside light. So that's where you zero it out. Kind of looks like a happy face with like it's squinting. That's the nose. And then this is like a one eye wink, right? So this is the outside light. This is to bring our light back. So to see how the light's gone. You press it, the light comes back on. You press it again, the light's away. But that doesn't mean that it's zeroed. So we're gonna move our patient in. Turn our light on because we need it. Oh, and this is at 32 because I moved the patient. I want to reset that. So the easiest way to reset it is just to bring the patient all the way out, and you see how the number's going back to 0. Okay, so now it's at 0, and now it's not centered again. So we want to center it. Move it over. They're probably on a board or something, and we're moving it over. So then I have to bring the patient up, center it there. This is centered now because this is just the face. Now I want to start at the chin. You can start at the chin or the top of the head depending on how your protocol is built, but it doesn't matter because as long as you know the direction of your tube and where the patient is going, then wherever you zero it out, you just control it on your console. So let's say we want to use the outside light. This is the outside light. We're going to place it at the chin right here. So if we use the outside light, you're going to press this to make it 0. Okay? So hold on to this. And it's going to be 0. So now the lights went out, and now you know that you're at 0. The scanning is going to start right here. But me, I don't like to start from the outside light. It's just kind of an extra step. I already go to the inside light. So let's pretend we're starting this all over, right? So you see how there's the outside and the inside? So I like to start in the inside. So I'm going to bring the patient and center them the bottom of the chin. So I'm already there. And instead of using this outside light, I'm going to use this inside light. Press 0. Not going to move anymore. It's going to stay there, but the light's going to go out, and now you know that you're at 0. And that's pretty much it. And then you go scan, and then you know the direction. So the patient's going to be coming out because you started at the chin. We're scanning the head. Patient's going to be coming out. So it's just pretend we're scanning now, okay? So it's going to go scan the head this way. And that's going to give you a sagittal view, I believe. And it's going to go back in. It's going to scan your AP view. And then that's when you set up your parameters. Tilt if you need to. Make sure your orbital meatal line is straight. Some places, facilities will get out of the orbit. Some places do. So just follow your protocol. And then the gantry will tilt. So it'll tilt accordingly. So this is tilting the gantry right now. You know it's tilting because this is moving. This will move back to 0. Just like that. So, yeah. And you see this is the gantry tilt, moving up and down, moving in and out, and then moving sideways. So that'll tell you everything. And, yeah. Okay. That's how you center with your inside light and outside light for Toshiba or any other scans. And just remember your centering, isometric, always in the tube, whether you're doing a head, a chest, abdomen, a pelvis, a foot, a finger, whatever. Just make sure you're centered and use your lines accordingly. All right. Toodles, noodles, monkey.